Recently our firm has started looking at other cases involving metal on metal hips. We started off doing the ASR litigation, and since then there have been lots of studies coming out showing that other metal on metal hips are having problems that are very similar to the ASR hips. Specifically, we've been looking at hips manufactured by Wright Medical. They make metal on metal hips, and the problems that have been reported are associated with the excessive wear and tear on the hip. What this does is it releases metal particles into the hip joint and can cause tissue damage in the hip joint, as well as increased metal levels in the blood, which can cause problems throughout your body. The metals we're talking about are cobalt and chromium. That's what these hips are made out of. Recently there was a study done in Australia where they compared the Wright metal on metal hip to more traditional metal on plastic hips. And what they found was that at 5 years the revision rate for the Wright hip was over 11%, which was dramatically higher than the revision rate for other traditional hips. The biggest problems with people who have Wright metal on metal hips is associated with the increased levels of cobalt and chromium in their blood system. And so what those things can do is they can cause tissue damage at the hip, and they have been linked to increased levels of cancer, heart problems, thyroid problems. And so we have been contacted by people that have these hips and have these increased levels of metal in their body, and we are looking into those cases currently. Many of our clients had regular x-rays performed by their surgeons, and the problem with an x-ray is that it doesn't show you the soft tissue damage, which can be caused by these hips. So in many cases what the doctors have been ordering is something called a Mars MRI, and this is a special type of MRI that can actually view the soft tissue in the hip and can see if there's fluid accumulation or what they call pseudotumors, which are associated with a reaction to the metal coming off these hips. So we would encourage anyone who has a Wright metal on metal hip to contact their doctor. And also they can contact us for a free evaluation and to get advice on their legal rights and how they need to proceed legally.